to speak for the next 10 minutes. Dr. Starkey, are you wanting to combine your time with the minister?
If that's acceptable to the minister.
Go ahead.
Well, thank you, Chair. Thank you, Minister. I'll start by apologizing if some of the questions I ask are a repetition from beforehand. I unfortunately was unable to attend the whole meeting, but I will tell you that most of my questions are related to the PDD file, and they flow from meetings that I have held with a number of folks in our constituency that have concerns, and I'm hoping that you can perhaps give me some answers on some of the questions they had. And again, if these questions have been asked before, I do apologize. I guess to start with support intensity scale, I'll tell you that I applaud your decision to eliminate CIS. I absolutely agree that CIS was a degrading means of evaluating the needs of PDD, persons with developmental disabilities. But I'd like to know, CIS was an expensive program. What did it cost the government to administer CIS before? How much is being saved because CIS has been eliminated, and where are those funds now being spent?
I think the license for CIS was obtained well before we became government, somewhere around 2011, 2012. And after that, they had staff there who was trained to administer that thing, and that was part of the intake process where we have other functional assessment and assessment of the individual needs and all that. So I wouldn't be able to speak to that cost that it was initially incurred back in 2011.
Agreed. I guess, Minister, what I was asking about is an annual operational cost for administering, the test. Yes, there was an initial licensing fee. That's correct. It was in place before you became government, but the annual fee.
It was the same individuals who were doing that intake within the existing staffing resources. They were coordinating that test as well, along with other assessment like functional assessment, other need assessments. So that was still the same staff who is involved in our case management.
Okay, so eliminating, basically you're saying then eliminating CIS hasn't resulted in any cost savings for the department?
Eliminating CIS resulted in relief to those who were put through that process.
100% agree with you, sir.
Yeah.
But I'm just wondering, Chair, if there was cost savings, and I'm taking it, but I'm not hearing directly that there were no cost savings. Is that correct?
I think I can confer with my Deputy Minister as well, but my understanding is that the staff resources stayed the same because it was part of the assessment for eligibility of PDD program.
So, Minister, my second question has to do with it's a more general question from the parents, and that is that the parents that I spoke with find that they're very frustrated that there does not appear to be an overarching strategy or framework or plan for the entire group of services or basket of services for persons with developmental disabilities. Now, I understand you're undertaking a review right now and that you've extended the deadline for input to that review. When is that strategy or when is that plan scheduled to be rolled out, and what can you tell me as far as when you expect to have that information out and make it public?
Information with respect to the scope and process of the review. I think the concern you raise is one that I have heard too, and reason for that is that PDD provides a range of services which include from few hours of respite to intensive home support and everything in between. Disabilities vary, individual goals, needs, they vary in different organizations. Their philosophy of service vary. So I have heard that concern, and that review will certainly help us explore that. But from department standpoint, the goal of this program is social inclusion, to help people include meaningfully in their community life.
Okay.
And this survey will close on the scope and process on 18th of April.
Right.
And whatever results we are getting in, we have a staff who's working on it, so we will be able to roll that as soon as practical.
Do you have a target date, or as soon as practical as?
As soon as practical.
Okay.
Yeah.
Okay. Minister, another concern that I hear from my parents is the transition point when someone with a developmental disability reaches the age of 18 and passes into what they call adult land, which I thought was an interesting phrase. But there's a tremendous amount of anxiety amongst families as to what happens at that transition point. Are you working with various organizations, and are you working through the family support for children with disabilities to try to reduce that overall level of anxiety? Because right now I can tell you it is a time, I talk to parents, for example, who have children who are 14, 15, 16 years old. They're still a few years away, and yet they have tremendous anxiety about that transition point. And what's being done to try to reduce that level of stress?
No, certainly that's a very good question, and staff at FASD, Family Support for Children with Disability, they start that process at age 16. But again, that process can vary from individual to individual and family to family, depending on their needs, depending on availability of the service provider, depending on the choice of the provider. And then once you reach 18, then you are in adult land, and then you have more control and autonomy. Staff has to respect the individual autonomy too. And in FSCD, like, parents are primarily the decision drivers. So nature of the programs also changes. Having said that we are committed to working with individual and their families to make sure that transition is seamless. But there is certainly improvements that can be made, and through this review we will certainly look at that if that's some issue. That's the issue raised by community.
Another issue that's raised by many advocates in my area is a concern that increases in funding are only going to increase funding to the overriding bureaucracy of the delivery model, and that in fact the funding is not working its way down to either families or individual recipients of the assistance from your department, Minister. Do you track what percentage of overall dollars spent are actually eventually delivered to either families or recipients? And if so, is that something that you would track in your business plan going forward? And if so, what is that number?
Yes, we do track that, and I have that information here available. But I do know that that $950 million, that is the community contracted service providers,
Right.
or through family managed.
Right.
47 is the government direct support, and 83.3% is being directed to frontline staffing costs, and the supervisory costs are 6%.
Okay, so 83% is going to staffing, the staff that deliver the supports, is that correct?
Yeah, frontline.
Okay.
And 6%
Is administrative, okay.
Supervisory.
Okay. Minister, just a couple of quick ones. Department of Education apparently has been working on an inclusive education policy framework for over 2 years, but it seems to have stalled. Have you had any communication with your colleague, the Minister of Education, on where that stands?
I think in all government policies, we are taking GBA plus analysis, which will require us to make sure that we are assessing the impact of the changes we are making to public policy, and that will certainly include a lens towards inclusive education in terms of those individuals who have disabilities. We will make sure that we provide those individuals with the right support to be meaningfully included in the education system.
Well, and I'll ask your colleague, the Minister of Education, this question as well, so I'll follow up with that. Minister, just in a few seconds that I have remaining, I just wanted to say that there remains a great deal of concern in the PDD community as far as what appears to be a lack of coordination of programs and supports that are being provided. This was something that came up a number of times during the course of my meeting with the families I met with, and also a concern with regards to the lack at this point of the advocate that was were called on for. So we'd like to see that position be filled as soon as possible.
Thank you.
Thank you.
At this point, I would like